Here in South Texas, we have a lot of stuff that's in the air, from the mountain cedar to other allergens, and frequently nasal irrigation is something that I recommend to my patients. Sometimes this doesn't go as well in the pediatric age group, but I let everybody know that with practice, we can definitely make it happen, and it can be super effective. So I want to do a quick little demo to make sure you can see that if the doctor's willing to do it, we can work on encouraging the kids to do it too. And sometimes parents can be great examples to say, hey, the whole family's going to rinse. So we take our rinse bottle. Then we're able to use some distilled water to make sure we don't have anything that could cause infection. Tap water is never recommended. After the distilled water is added, we're going to add a pre-mixed salt packet to our bottle. The salt mixture can be purchased at any major pharmacy or grocery retailer, and I tell everybody the generic brand is just fine to use. Typically, you can look in the allergy and cold section, and that's where you're going to find both the rinse bottles as well as the salt packets. The distilled water you can find at any major supermarket. You can use other recipes and make it yourself, but sometimes that burns, and I definitely don't recommend it. I have definitely tried it, and it isn't quite as fun. After that, we're ready to rinse. We can do a quick shake to make sure that any of that salt is fully dissolved. I typically have kids and adults do their rinses after they take a shower or even in the shower, but it can also be easily done over the sink. What you are going to do is make sure you really lean your head forward. That way it can go in one side and come back out the other. Then you can go back and forth until the bottle is empty. So you can see I was able to rinse one side out, and now I'm going to switch to the other side and do the same thing, just leaning forward to let it drain out nice and slow. After everything is done, you can gently blow your nose and breathe much better. It can be done as many times as you need to when you're sick, and can be super effective.